With four trends converging, the future of health systems around Europe is at risk. Population in the old continent is ageing faster than anywhere else but Japan. By 2030, the proportion of people aged 65 and up will grow by 1/3 to reach 24%. There has also been an increase in chronic disease. Some are age-related, but obesity rates, for instance, have tripled across Europe since the 1980s, and the numbers of those affected continue to rise at an alarming rate. Meanwhile, technology spending is on the rise. Between 1975 and 2006, the cost of bringing a new chemical or biological entity to market has risen tenfold, and costs are still rising. Finally, patients have higher expectations, with over half of Europeans saying costs should not be a factor in medical decisions. All of these trends are raising healthcare costs, and policymakers need to respond. In research aimed at provoking debate about possible solutions, the Economist Intelligence Unit has developed 5 distinct scenarios for healthcare in 2030. The endgames of today's trends. In 2030, technology marches forward on all fronts. Most diseases are cured. Our vital signs are monitored by electronic patient managers, which tell us when to pop that pill.
Yes, it's a thrilling time actually, because we are now able to work closely together with medical devices industry, so we deliver our drugs, sometimes already in nanotubes, and the nanotubes can go to the digestive system and they can really nicely target the diseased area. So that's a tremendous breakthrough, because it can get rid of all kinds of old-fashioned things.
In 2030, national healthcare systems are replaced by a federal European one to bring economies of scale and cost-cutting. Healthcare is mainly delivered by a pan-European electronic highway.
Although the treaties do not say anything about it, it may be possible that we will see more and more integration in the future. With one element important in the picture, we always talk about member state, but Europe is highly decentralized in healthcare. So going to a federal system at European level, when already several countries are federalizing more and more their system at healthcare level, that might be a challenge.
In 2030, European governments dedicate healthcare funds to the prevention of ill health instead of treatment. Doctors are paid to keep people healthy.
Prevention, it is more cost-effective than cure. That will get important health impacts, and health is an important key driver for economic development and for well-being. It's central to invest more in these areas. It's central to learn to communicate that from the health to the sectors and make the whole government accountable for the health of those populations, not only the Minister of Health.
In 2030, unable to pay for everybody's treatment and care, policymakers tackle the problem of health inequalities by focusing on the health and social needs of vulnerable people.
Well, what we're looking for, our vision, is that every patient gets access to quality and safe healthcare, and that they're involved to a level that suits their ability. The problem is that there are many parts of populations and people with different conditions that can't do that.
In 2030, no longer able to sustain the costs of paying for healthcare, governments have handed the responsibility over to the private sector, like in the US.
I'm a true believer that by having a greater role of the private sector, not only do we put more choice into the marketplace, but by putting that competition in place, we should actually see the improvement of both sectors, which I think can only be good for the patient and produce better patient outcomes.
The healthcare debate today is dominated by different factions within the healthcare system. But if we want to ensure that our healthcare systems remain viable, we need to think flexibly, driven by one thing and one thing only: the health of Europe's citizens.